My favorite herbs, which I guess was so underrated that my supplier was even going to discontinue it at one stage until I kicked up, is Mexican valerian. And it's a relative, obviously. It's a Valeriana edulis, subspecies Procera. It's a relative of our European valerian, Valeriana officinalis. But it's quite different phytochemically. And it was actually when I was a herbal student in the UK, because I had a chemistry background, I was doing a little quality project for my teacher then, Heinz Zelstra, and I'd be doing thin layer chromatography on herbs. And I had this beautiful textbook, a German textbook on herbal thin layer chromatography, and it was showing the profiles of the Mexican valerian against the European valerian and how different they were. And especially the Mexican valerian was rich in these components called valopotriates. Now, the valopotriates are quite interesting because at that time in Germany, although it faded out a decade or so later, there was actually a medical drug made from isolated valopotriates that was given to people for anxiety, that was prescribed by doctors on the German market, the isolated phytochemicals from the Mexican valerian, and there was one other species I think they were using as a source. So it's quite different to European valerian, which doesn't contain very high levels of valopotriates as well. So we think valerian, and certainly it smells like valerian. Oh, it's just the same, but it's actually it's quite different, and it's a great backup. Now, the first thing I like to say is that I use both valerians, European and Mexican, and I get great results from them. And occasionally people might say they don't do much, and that happens with herbs. So you switch to others that might help them. But I've never had any of the serious issues in terms of adverse effects with either of them. And yet I hear on the grapevine that a lot of naturopaths don't want to use valerian anymore because it gives you nightmares and causes all these side effects. And I'm thinking, not my experience over 3.5 decades. Maybe it relates to the quality. It's a quality issue, perhaps. There is this thing of, and patients come and tell me about it, don't give me valerian because, it actually stimulates me and I can't get to sleep. Well, I'm skeptical about that, to be honest. Again, could it be a quality issue? Could it be what's called a nocebo effect because it has that reputation? Could be a one-off where they weren't going to sleep anyway and they then attribute that to the herb. So it has that reputation, but please don't shy away from valerian. It's such a wonderful asset to be using. And as to the Mexican valerian, if I look at the feedback I get in terms of relieving anxiety, tension-related pain, and helping with sleep, it's often the most stunning feedback I get from patients is for the Mexican valerian, which I guess testifies to the value of the valopotriates that are in there. And the valopotriates are not stable, but, and there was this aha moment in the research when they said, hey, it's all placebo because the valopotriates are not stable. But then they looked at the decomposition products of the valopotriates and they're effective as well, at least in rats and mice. But they are effective because this herb does work. So it doesn't matter that the valopotriates are somewhat decomposed in the liquid extract or tablet. The same decomposition probably happens right away when you take it orally anyway. So it's a bit meaningless saying they've decomposed due to your gastric acid. So, and I can tell many anecdotes. Like I had one patient with, TMJ syndrome, terrible pain at night. And I said, have 6 Mexican valerian tablets before you go to bed. And she said it worked like a miracle. I can sleep right through. I have no pain. So it's particularly good for pain management, I believe, in patients that have central sensitization syndrome. So that's the TMJ is part of that. Irritable bowel is part of that. Even fibromyalgia is part of that. So I think very, very underrated based on the clinical results I've seen.